Ladies and gentlemen, please welcome to the stage Shawn Singh, CEO and Director of Vistagen Therapeutics, and Vivek Murthy, Surgeon General of the United States.
Well, good morning, everyone. Thank you for joining us today. America has a problem, and we need to see a doctor. So we're very fortunate today to have an appointment with the nation's doctor, Dr. Vivek Murthy. Welcome.
Thank you so much, Shawn. It's good to be with you today.
We have an ominous title hanging over us today, mental health crisis. And as we sit here now entering into the third year of the pandemic, what we've seen quite often is disruption in routines, social isolation, economic distress, political unrest, civil unrest, and we need to do some things about it. So we sit here at a crossroads today. We have a tremendous opportunity because we have the potential of both the private and the public sectors working together. Mm-hmm. We'll talk about that today. If there's two things I think we concur on, just in the short time we spent together, is that this is fixable. With the power of the public and private partnership, we can get it done. It won't be easy. It won't get done in a minute, but we can make it happen. And secondly, that hope is on the horizon. There are innovations that are driving encouraged folks to be patient, to endure, to communicate, to destigmatize mental illness. And we are really at a visionary path moment where we can see forward things looking potentially better, but we have to put the work in. Mm-hmm. So let's get to it. How do you look at the national mental health crisis? What do you feel are the most significant indicators and the most worrisome indicators of America's national mental health crisis?
Yeah, well, I'm so glad that we're talking about mental health and well-being, because when I think about the many crises facing the world right now, I really see this as one of the biggest ones that we are dealing with, not just in the United States, but around the world. Many countries are struggling with rising rates of anxiety and depression. We know that loneliness and isolation is a profound challenge in the United States and around the world. Even though we don't talk about it as much, it is there, and the numbers are staggering. There are more people who, for example, in the United States, who struggle with loneliness, more adults, than adults who have diabetes in the country. But think about how often we talk about that, and the health consequences of issues like loneliness are profound. I'll give you three numbers, though, that I keep in my head as reminders of why this is so important. In the United States, in the decade before the pandemic, before COVID-19, there was a 57% increase in the suicide rate among young people. That's staggering, a 57% increase. And the pandemic has actually made things worse for many, many kids. The second number I keep in mind is 11 years. In the United States, it takes on average 11 years from the time a child has symptoms of mental health struggles to when they actually get evidence-based care. 11 years. That's 11 years when a child may be getting worse, when they're struggling at school and in their community. It's also 11 years where a parent is seeing their child suffer. And as a parent, myself and Shawn and I are both dads, but I don't think there's anything worse as a parent than to see your child suffer and to not be able to help them. But that is what millions of parents are experiencing in the country. And the last number I think about is 42%. 42% is a percentage of high school students who say they feel persistent feelings of hopelessness and sadness. 42%. High school is a time, it's not easy, right? And we all remember the challenges and travails of high school and middle school even more so. But our youth we think of as a time where we should be looking forward to what's to come in life, where hopefully there's a well of optimism inside us. And even though life may be hard, we think that there are better things around the corner. But 42% of high school students today in America don't feel that way. When you put these things together, you realize that we have a profound crisis when it comes to mental health and well-being in our country. And it's not just us. Many other countries are struggling with mental health challenges as well. But to really address it, I think we have to be able to think about this on several fronts. One is, how do we fundamentally change access to treatment? And that includes what treatment is itself. How do we make sure we have better treatments? How do we make sure that there's a workforce that can deliver those treatments? How do we use technology more effectively to bring treatment to where people are instead of expecting them to travel 30 miles and wait 6 months to get an appointment? So there's a treatment bucket. There's a second bucket around prevention. We know that there are programs, school-based, community-based programs that work. They're highly effective in addressing mental health struggles early in life, but we're just not implementing them. And then finally, there's a third bucket around culture, right? Culture is how we think about issues. And the truth is that there is still a great deal of stigma around how we think about mental health. It's why people don't talk about it often. Even though about 50% of CEOs, for example, struggle with loneliness and feeling like they're on their own by themselves, which is incredibly stressful, it's not something we talk about often in C-suites or in boardrooms. So we have to overcome that stigma. I'm encouraged that actually if you talk to young people today, they are much more willing than prior generations to have conversations about mental health. But we still have more progress to make. But this will be the defining challenge, I believe, of the 21st century, and the key to whether or not we can unlock what I see as one of the most powerful resources that we have, which is someone's mental health and well-being. We know that impacts not just their physical health, but it also impacts their productivity in the workplace. It impacts how our kids do in school. It impacts how we show up in the public square and engage from a civic perspective. So I think about mental health as the fuel that allows us to do everything else we do in life. And right now, we've got problems with that supply, and we've really got to address it. That's why this is a domestic as well as a global crisis.
Tremendous points. And that's what drives us at Vistagen. We're focused on social anxiety disorder. And as you noted, these disorders often start very young in age. Between 8 and 15 is a typical onset for social anxiety disorder, which can lead to depression, which can lead to suicidality, and the alarming rates that you noted. And we need better treatments, but we need more of what's been happening. If there's a silver lining in the tragedy of the pandemic, it's that we've seen destigmatization of mental illness. People have reasons to be worried. They have reasons to have a need to talk to someone, whether it's at the high school level, whether it's in the dining room, whether it's in the boardroom. There's just, unfortunately, so much civil unrest and political turbulence and polarization increasingly in our country. But the talking does help, right? Every single medication that any of us in the private sector that we're developing for neuropsychiatric disorders, they have to be augmented by talk therapy. So that access to the talk therapy is critically important. That's one of the foundational pillars really to this solution. And your office can do quite a bit about it. And you emphasize that social belonging and that community connection. Your work is focused on that for quite a long time. What's the U.S. Surgeon General doing? What's your office doing? What programmatic advances have there been to try to facilitate and really fortify those pillars in the mental health paradigm?
Well, I'm glad you raised this, Shawn, because you're hitting on something I think is largely underappreciated in society, which is that one of the pillars of mental health and well-being is social connection and belonging. And this is because as human beings over thousands of years, we evolved to be social creatures. That doesn't mean that we all evolved to be extroverts. I say that as an introvert myself. But we all evolved to need some form of social connection to optimize our function. So just think about this for a moment. Go back to thousands of years ago when we were hunters and gatherers. What happened to the person in those times who said, you know what, I'm going to go it alone. I don't need anybody else. I can do this. I'll tell you what happened to that person. That person got eaten by a predator or they starved, right? Because that was the nature of life then. And so over thousands of years, we evolved to realize that, hey, if we take turns taking watch, at night so that others can sleep, but we can also keep watch for predators, we'll all sleep better. If we pool our food as supply, we're less likely to starve. If we take turns providing childcare for other people's kids, we can all make it through the early years of parenting. This is what we learned, right? But the bizarre thing is we're living through what I think of as an odd, in a sense, like detour in human evolution, which is we're living in a time where modern culture tells us that being strong is being self-sufficient, not needing anyone else. And that is just contrary to how our bodies have evolved. Our circumstances may be dramatically different than our hunter-gatherer days. But you know what? Our neurological systems are still very much the same. And they respond to human connection in very powerful ways. So you understand why this is so important, but it's not just important for making us feel better. It turns out that when we struggle with loneliness, we're also at increased risk of anxiety and depression, but also dementia, cardiovascular disease, premature death, sleep disturbances, impaired wound healing. The list goes on because there's a profound connection between how the connection we feel itself, social connection, and health outcomes. But it also impacts our performance. There's been some great work done by the late Sigal Barsaid from Wharton at the University of Pennsylvania showing that when people struggle with loneliness in the workplace, it negatively impacts their creativity, their productivity, and also has impacts on their retention in the workforce itself, as well as an impact on the people around them, right? And so it turns out that cultivating connection in your workplace, building a culture where people feel like they belong, where they're valued and where they're connected to one another, that is extraordinarily important for them, but also for how they function in the workplace. And finally, I'll say this, for me, this has been a core priority for some years now because it is deeply connected to health and well-being. And in our office, like when we issued in December a Surgeon General's advisory on youth mental health, we highlighted social connection as a key part of that. And this is why it's so important for us to think about technology in particular and how technology and social media especially, we got to think about how can these tools be agents of connection, if you will, as opposed to disconnection. What I worry about is when I talk to young people around the country, as I do often, they often tell me with social media in particular that they feel like they have to be on it. But two particular things they feel like it does to them. One is it makes them feel worse about themselves because they experience this culture of hyper comparison, if you will, where they're going on, they're seeing all these amazing things everyone else is doing and feeling worse about themselves, which many of us may feel, because even though you know that people are posting about their best moments, they're taking pictures with their best sides, or they're doing everything, they're doctoring their photos, they're editing things to make it, to put forward the best moments in their lives, it still feels, bad when you see that people have lives that perhaps might be better than yours, and when it feels like people aren't struggling with the things that you're struggling with. And so the experience of social media for many young people, as they tell us, is that of comparing your average days to other people's best days, and you always end up coming up short. But the other thing they tell me is that it ends up making them often feel worse about their friendships. That they go online, they see all these things that their friends are doing without them, and they think, maybe I'm not as close to that person as I thought I was, right? So there's an important role for us to think about how to utilize technology to ultimately help build connection, because that's what ultimately it should be doing. But in our office, we're also working on an initiative that we haven't launched yet, but will be hopefully coming soon, which is focused especially on social connection and community, on how we rebuild that. And there's a lever we have to pull in our individual lives. There are steps individuals can take to which we can actually, with a little bit of time, make a big leap forward in increasing the connection in our life by how present we are with others, by putting 15 minutes aside, for example, each day to connect with someone we love, by looking for opportunities to serve others, whether that's helping somebody who might be going through a difficult time or dropping a cup of coffee off to somebody in your workplace who may be struggling and having a hard day. There's an individual lever, but there's also an institutional lever. So there are steps that workplaces can take to actually promote greater connection. There are steps that schools can take to actually invest in social and emotional learning and in the tools that young people need early on in life to build healthy relationships. And finally, there are policy solutions here as well. A government can't solve all of the problems that we have. It can't create a more connected world on its own. But what government can do is actually help invest in research to help us understand what strategies work to enhance connection and what doesn't work. It can help bring together people from across sectors to ultimately address the connection challenge that we have. So the bottom line is and I know Concordia has done so much work thinking about how to build public-private partnerships. This is a place, where the private sector is a key part of building a more connected world. And if we do that, we will not only improve our health, we will improve how people perform and function in school and the workplace. We will also increase the likelihood that we can, as a society, come together during difficult times and take on big challenges. Think about what we just went through and are still going through with COVID-19, a global pandemic. Think about the specter of climate change and everything that we have to deal with. Think about the profound challenge we have with misinformation right now in society and how that's making decisions harder. All of these challenges are very difficult to deal with if we are constantly divided. And the truth is that over decades, Shawn, as many of you know, we have seen a decline in community metrics across the country. Fewer people engaging with friends, belonging to social groups, and more people feeling isolated and lonely. So for the sake of our health, our function in society, and the overall well-being of our nation, we have to reinvest in social connection. And that's why our office is focused on building an initiative, which we'll be laying out in time to come.
That's excellent, because we've done a lot of field research, and it's clearly, even before the pandemic, the main drivers of social anxiety were team orientation in the workplace and in the academic setting, students feeling uncomfortable that they're going to be called on, or colleagues afraid to present to their peers. Right? That fear of judgment, humiliation, embarrassment, that's what drives social anxiety disorder. That's what has led us to develop our lead drug, PH94B, which is just finished our first phase 3 study. So the medication also has to connect with the communication, because these disorders, they're biochemical underpinnings. They require neurotransmission to be different. We need new medications. We haven't seen much advance in anxiety and depression disorder medications for decades. So in addition to expanding the connections and enhancing the pillars and the foundations for those enhancements to social belonging and connections, we really do need to see additional new medications developed. And so that's one thing the FDA has been very focused on, and your colleagues at the FDA, with non-traditional approaches to developing new drugs with new pharmacologies that are different than benzodiazepines or the current antidepressants. So we need drugs that work faster. We need drugs that are safer, that have fewer side effects, fewer safety concerns than what we have available today to treat people who do seek that community connection, that talk therapy, and that enhanced access. One of the things we've seen, we're so encouraged by the increase in telehealth and the ability to privately access that kind of care. And your point about enhancing it at the very early age, because we see, again, ages 8, 9, 10, fundamentally people during the pandemic, especially at the high school level, when it's so important in those early teen years for the brains to form, we've had to execute strategies of avoidance and self-isolation because of the pandemic and physical health. So I'm encouraged by the fact that you and your colleagues are turning the corner and really raising the volume around those connections and enhancing access to care. At the same time, with an eye on the fact that we do need new medications to augment that care. Well, we see these anxiety-provoking clocks always in front of us whenever we do these talks. But listen, certainly on behalf of all my CEO colleagues out there, we are driving with patient endurance to try to develop a new generation of medicines to try to complement the work that you and your teams are doing with communication. Thank you for your timely and your very purposeful leadership. It's essential. And to all the Americans, millions of Americans, and millions across the Americas, two things to take away today. One is, again, this is fixable with strong public-private partnerships, with enhanced awareness to destigmatize mental illness, to encourage talking and community connections. This can get fixed. And with those kinds of innovative programs that you were talking about, and the emphasis, especially with the entire United States of America behind a problem, there's hope on the horizon. And I coach a lot, and I often say, with clear eyes, full heart, we can't lose. And ladies and gentlemen, Dr. Vivek Murthy.
Thank you. Appreciate that. One thing actually, Shawn's point is really good, and it just inspired me to think of one last thing here, which is when people think about hope and where hope comes from, on an issue as big as this, mental health and well-being, sometimes it can be tempting to just say, God, somebody else has got to come in and fix this, right? Yeah. There's got to be some big company, big government that comes in here and solves this problem. But the reason I actually feel very hopeful is because there's so much that we can do as individuals and as organizations to help address this mental health crisis. Yep. So I would leave you with just two things to think about. One is in your own life, to think about the steps you can take to address mental health. So for example, what are you doing in your own life to invest in human connection, recognizing the powerful impact that can have on your mental health? Could you take 15 minutes a day to call someone you love? Could you make sure that during those 15 minutes you're fully present, that you're not actually looking at your phone all the time, as I sometimes do, I'm not proud to say? Can you make sure that you're there for the people in your life when they're in crisis, just as they will often be there for you? But then second, can you think about the places in which you work and how to create a culture of connection in the workplace? People spend a third of their life or more in the workplace. Our workplaces can be engines for human connection and for mental health and well-being, but it requires creating that culture of connection. And it's not always about putting lots of time and money into that. It's often about leading by example as leaders in prioritizing relationships, in checking in on people, and ensuring that we're tracking and enhancing the well-being of people in our office. And in our office, when I was Surgeon General the first time around, we had something we did that took 5 minutes once a week, which was our most powerful engine for driving connection in the office. We would, at our all-hands meeting, ask people to, one person during each week, to bring in pictures that they wanted to show us of any part of their life, as long as it wasn't about their current job. And people brought in all kinds of things. But we learned about them through those pictures. My aide, who was a former Marine Corps member, he brought in, we thought he'd bring in pictures of his time in the Marine Corps, about the soldiers he worked with, but he brought in pictures of his mother and father. His father had passed away, and he told us that he saw in his children now, every time they picked up an instrument, memories of his father, who was a professional musician. And he showed us a picture of his mother, and he said that his mother, whenever he was in deployed overseas on a mission which was incredibly dangerous, where he knew he may not come back alive, where he felt that pit of fear growing in his stomach, he would think about his mom. Because his mother had raised him and his brother largely on her own. She had put food on the table every night. She had raised him to go to college and have opportunities that she never had. She was his picture of strength. And in those 5 minutes, we felt so much closer to Luis than we had felt over the past year. And I share that just to say that we are so hardwired for human connection that it's not always about the amount of time we put in. It's about the quality of that time. It's about the opportunities that we create in our workspaces for people to see each other clearly and to feel that sense of belonging. So I'm so glad that we had this conversation here today. Mental health and well-being is, I think, going to be the defining issue of our time. And it is up to all of us to put our shoulder to the wheel and to move our country and our world to a better place. So appreciate you being here.
There you have it. He gets to beat the clock. Thank you.
Pleasure. Appreciate it.